Hey YouTube, my name is Dr. Bailey Devine. I'm with Behavior Experts of Texas. We are a nonprofit organization that offers behavioral therapy to individuals with and without disabilities. I wanted to make a video today regarding why psychological evaluation and diagnosis of children can be so tricky, and why oftentimes that process can be lengthy and may not always result in an accurate diagnosis right away. I see this as being a big source of stress for many of the families that I work with, and oftentimes when I begin working with a new client, they may have a host of different diagnoses, but after working with them pretty intensively for a few weeks, sometimes I get the feeling that that is not an accurate diagnosis. And then my job is to help parents get on the right track to finding a more appropriate diagnosis so that their child can be referred to the right therapies that they need to improve. So this video is about basically what goes on during the psychological evaluation process that can be tricky toward securing the right diagnosis. So these are not all of the reasons why, and I should point out that I myself do not do assessment or diagnosis. I treat behavioral issues. So a lot of times I'm working with kids with autism, ADHD, oppositional defiance disorder, some mood dysregulation issues. So I don't do the assessment personally, but it is so important in what I do to know exactly what diagnosis your child has and make sure that everyone who works with your child is clear on what is happening with them so they can really get the therapy that they deserve. So we are really talking about diagnoses conducted by licensed psychologists or medical doctors. This video does not touch on school evaluations. The reason for that is, although school evaluations can and often are very useful, a lot of insurance companies will not consider those a valid diagnosis and will not provide partial payment or full payment for any services that you try to seek after getting just a school evaluation. So this is really in reference to diagnosis conducted by a medical doctor or someone who's licensed to do so. So the first most obvious point is that when we're talking about kids who might have ADHD or autism or oppositional defiance disorder or any of these kinds of things, it's not a blood test. It is a behavior checklist. So by its very nature, it means that the person doing the assessment must observe the behavior that you are concerned about. So a blood test is a much more accurate way of diagnosing things, and we just don't have that ability yet. So basically, all of this is based on what someone perceives your child to be doing or not doing, and how that might compare to typically developing peers around that age. So in a typical psychological assessment appointment, you will take your child to an office. There will be a waiting room, typically, and the psychologist or the MD, whoever's doing this process, will call your child back to work with them independently for a little bit if they are old enough and capable enough to do so. They may deliver a battery of different tests, and they may ask your child to engage in some different role plays or put them in situations where they can assess different types of behavior. The rest of the assessment process typically involves you or anyone else who's in close, regular contact with the child filling out questionnaires. That could be a school teacher, that could be someone at their preschool, that could be you, that could be grandparents, whoever you deem an important figure that spends a lot of time with your child. So it's important to note that, as you can probably guess, this is not a very long appointment. Some kids have the ability to hold it together, so to speak, for an hour or two at a time, especially when they're in front of a stranger who they don't know and in a strange setting. So the behavior that they emit under those conditions might look very different than their natural behavior or how they behave at home or in school. So the picture that the psychologist is getting may not be what your child really looks like on a day-to-day basis. Another thing to note is that those questionnaires that you are filling out or a teacher might be filling out, you're not trained to answer those questions. So depending on your level of confidence with what's being asked of you and how well you feel like you can speak on that, you can have a variety of different outcomes in terms of accuracy for answering those questionnaires. Another thing is that typically psychologists will do a battery of tests based on their best guess from kind of an evaluation intake process of what they think might be going on with your child. So if you know, for example, nothing about autism spectrum disorder, you've heard of it, but you really have no idea what the symptoms look like, and you've never really considered whether your child might have autism, and you don't say anything about it to the assessor, they may not run an autism battery, just depending on how your child presents during the appointment. So if it's not asked for, and then if your child is really on just their best behavior and they look different, so to speak, during that appointment, then the psychologist might not even really touch on potential diagnoses that your child could have. Another thing that can be problematic is that problem behavior, in other words, things that kids do that we really don't love as parents, screaming, whining, crying, sometimes hitting, biting, urination accidents, bowel movement accidents, picky eating, sleep problems, all of these things are actually a normal part of development. And really, when we start to become concerned is when these behaviors stick around or worsen over time, when they should be kind of dissipating or becoming less frequent as the child ages. But because problem behavior is a normal part of the developmental process, it may not register, so to speak, as a problem if you're seeking diagnosis very young for your child. And again, I know a lot of toddlers who act completely differently at home for their parents than they would in a setting with a psychologist who they've never met before, who might be wearing a white lab coat and might look very formal. So these behaviors, although a normal part of development, can be extreme in your child, but may still be only viewed by the psychologist depending on the context as within normal limits. One really difficult thing about the psychological evaluation process is, like I mentioned, you're taking your kid to them, and it's a really contrived setting. In other words, it doesn't necessarily mimic what your everyday life looks like really in any way. And the psychologist does not have an opportunity to observe your child in any social situations. They don't go to school with them. They don't watch them interact with peers. They don't watch them take demands from you at home when they could be running to the iPad, or they could be watching TV and you need them to stop, or they could be playing with siblings. And for things like autism spectrum disorder, which is primarily an issue in social learning, that really limits the psychologist's ability to hone in on asking themselves whether or not the social development for your child looks typical or atypical. I don't know any psychologists who actually go on site and observe kids in a group setting. So that can be one part of the process that's really difficult. And if you have a child who's highly verbal and does really well in school, but may have some social difficulty, may not have friends, may be teased, that could be for a variety of reasons, but all of that information is sort of going missed in the evaluation process unless you really insist on getting that information to be included in some way. Another thing is that really motivated parents who want to help their kids will often take their kids in for evaluation when they're very young. This is definitely a good idea, but what it means is that the child may just be too young for some of these issues that you see to really show up strong enough in the evaluation process. As the child ages, sometimes things that were present at 2 and 3 years old can become more rigid and more difficult to manage over time. So again, you might be seeing something in, let's say, your second child, and you know that that looks different than the way that your first child developed. But it's still within normal limits at that age, so it may not register as being a problem until the child is older, when we expect for those issues to have dissipated by that point. In other words, 3-year-olds have a much more limited set of behaviors that they engage in generally. There's a little bit of talking going on, there's a little bit of walking going on, there's a little bit of play going on, but there's much less of all of those things than you might see in, for example, a 9-year-old. So as your child ages, we really start to be able to see a little bit better where those abnormalities or deficits or excesses or weird things might be occurring. Another limitation is that a psychologist could in no way test your child for everything in the Diagnostic Statistics Manual. So they are going to be working with what they think might need to be tested based on your initial intake. This is kind of circling back around to a point I made a little while ago. If you don't know anything about autism and you don't ask for an autism test to be conducted, and the child presents as doing fairly well in most ways, maybe development was not delayed in any significant ways, they're doing great academically, but they have some difficulties with social things. That could look like anxiety, that could look like depression, that could look like a whole host of things that might not be autism. So unless you specifically asked for your child to be assessed for autism and had some kind of descriptions for why you think that might need to be tested, then your evaluator or assessor just might not even look into that. And I've seen that happen quite a bit. So those are just some of the reasons that this process can be really tricky, can be really frustrating, and why I think sometimes I see diagnoses that are not accurate. So the purpose of this video, though, is not to make it sound like you shouldn't seek diagnosis or evaluation. If you think something is off, or if something is different, or if you have concerns, you absolutely should. But here are some things that you can do that may help that process and may help your child get a more accurate diagnosis. The first thing is to take notes. Take notes on everything. Write down exactly what you said, exactly what your child said, or what another kid said to your kid and how your kid responded. You want to have notes for anything that is of concern to you so that you can tell the psychologist or the doctor in sort of a play-by-play, here are things that I'm seeing with my kid. This happens, and then this happens, and then this happens. So be a diligent note taker. The second thing is really use that cell phone and get videos. I would not do so in a way that embarrasses your child, so you would want to be discreet about this. But if you feel like your child's tantrum behavior or social interactions are just really not within typical limits, I would discreetly try to get video of those instances. So don't hold your phone right in front of your kid's face and go, I'm videoing you right now, because that's going to change their behavior in a way that won't help. But if it's possible, it may be worthwhile to take video because, like I mentioned, your psychologist or your assessor is not going to be able to accompany your child to all the settings that they need to be observed in. But if you can show them video, that can provide a lot of additional information. The last thing is really to be brave and ask the people that work with your child if they have a hunch. It's true that preschool teachers don't necessarily have special education in what the developmental disabilities look like, but they have worked with kids typically for many, many years and many, many kids. And they have seen a wide variety of child development. So if someone like a preschool teacher says, hey, we see some behavioral issues, we think that you need to work with somebody toward fixing these, just get really brave and say, do you have a hunch? Do you have an inkling? Do you have any thoughts about what might be going on here? A lot of people who work with kids in a setting like preschool or public school either A, are not allowed to say what diagnosis they think may be on board, or B, they just really don't enjoy having that conversation because parents don't typically respond super well to it. But many of them will know a direction that you should look into. So I would suggest you take advantage of those people's skill sets and ask them genuinely, what do you think is going on here? And sometimes they may be able to help you ask for the right assessment batteries to be provided, and they may give you clues into something that you don't have any idea about. I know during COVID, a lot of parents have missed out on the opportunity to observe their kids in their school settings because we've had rules like parents aren't allowed in, they have to stay outside the door at drop-off, and things like this to keep people safe. So many parents of young kids who were born just before COVID have toddlers now who may have atypical development from a lack of social opportunities and coaching, or because there is some kind of developmental delay on board, but parents don't even know that because COVID has so interrupted our ability to socialize with each other and to be around our kids in social settings that we as parents may not really have a full picture of what's happening for our child every day. So rely on the resources you have, ask the people who work with your child what they think, make sure that you are seeking out a reputable diagnostician, a licensed psychologist, or a doctor, and make sure that you are regularly having your child evaluated every 3 or so years, especially if you feel like that initial evaluation did not give you a complete or accurate picture. A lot of times I see kids get a PDD-NOS evaluation the first go around. That stands for Pervasive Developmental Disability Not Otherwise Specified. And basically it can mean we know development is atypical, but we're not exactly sure how yet. In another 3 years, it's quite possible that enough development has occurred that now we can firmly give this a label. So the diagnosis can change, which means that you have a better chance at getting the right therapy for your child, and that insurance can be involved in that process sometimes, in some respects. There's an asterisk with all of this always, for paying for those services. So I hope this video has been valuable for you. Please leave a comment if you have any questions or if there's any other topic you would like to learn more about in the future. And I hope you guys have a great day. Bye.